You are live.
Hello, everyone. I will warmly welcome everyone to this World Sight Day in October 2020. It is with a heavy heart that I have to announce that Dr. Natarajan sir will not be joining us today. And I am taking this opportunity to introduce our speakers today on his behalf and give the welcome address on his behalf. It greatly grieves me to tell you that his grandmother has passed away today, and because of her demise, he will not be able to join us for this August gathering. So let us just begin with a short 1-minute silence in her honor, so that may her soul rest in peace. I will share my screen. Yes, let's please have a 1 minute of condolence silence. Right. Thank you, everyone. I'm Dr. Aishwarya Iyer. I'm Dr. Natarajan sir's fellow in vitreoretinal surgery, and I take this opportunity to welcome you all to this World Sight Day celebration that has. So this year's theme for World Sight Day is Hope and Sight, as decided by the I. Hello, am I audible? Sorry. Yeah. So first, let me give an introduction of what is World Sight Day. So that I'll just. Right. So World Sight Day is an annual day of awareness held on the second Thursday of October to focus global attention on blindness that is due to visual impairment, preventable visual impairment. This year's theme is Hope and Sight. So more than 1 billion people cannot see well because they don't have proper access to glasses. Over 3 out of 4 of the world's vision impaired are because of avoided refractive errors. Like, it's very sad to know that a lot of people don't have access to glasses, and that's what's making them blind. So that is now a great point of interest for us. So this year we've decided to make that the theme. And what can be done to arrest this fact? So the most important thing is that you need to arm yourself with the prevalent data of the eye health system information of your country. So only if we know what the numbers are, will you be able to do something about it. The next more important thing is that you need to have some good political commitment to take action in order to integrate the universal health coverage and integrate that along with the health plan, that eye care should be a part of the health program and the health plan of your country's initiative. That is what Hope and Sight is all about. And this World Sight Day, let's find the solution to ensure that everybody everywhere has access to sight. Let the fact that there aren't enough people who have access to glasses be a reason for blindness. So let's pledge to spread this message of hope and sight and make sure that we eradicate preventable blindness. So hope and sight, everyone. Thank you. So with this, I take the opportunity to welcome our 2 speakers for the day, Dr. Ivo Kocher and Dr. Gyan John Prakash. So Dr. Ivo Kocher is the CEO of the International Council of Ophthalmology. He carries with him more than 20 years of experience in public and not-for-profit sectors. He holds a medical degree and began his career as an eye surgeon at the Czech Republic, his native country. His passion to promote education led to his efforts to spearhead the establishment of the Lions Ophthalmology Education Center in Prague, now attended by over 3,000 ophthalmologists from many countries. He holds a Masters of Science in Community Eye Health from the University College London, a Master of Arts in Diplomacy from the Diplomatic Academy of London, and a Master of Business Administration from the European University in Geneva, Switzerland. Wow, that is impressive, sir. And in 2002, Dr. Ivo was appointed by the World Health Organization as WHO Global Coordinator of Vision 2020 and fostered international collaborations of key stakeholders in order to shape the global public eye health agenda. We welcome you with open heart and a very warm welcome, sir. Thank you so much for joining us today. Over to you, sir.
Thank you so much for the introduction. I just will try to bring up the slides. Just need a moment. I'm wondering if you can see them already, or I still need to do more clicking.
I think you need to share your screen.
Yeah. Is it okay now?
Yes, sir. Very much.
Yes. Okay, thank you so much. So thank you very much for the introduction. I just need to add that after many years with the World Health Organization, I have now moved and I'm in the role of the Chief Executive Officer of the International Council of Ophthalmology. So it's my great pleasure to be with you today and to talk about what has been done in the past, the legacy we can build on regarding World Eye Day, and also the key resources we can use today, but not necessarily only today for the World Eye Day, but during this period, which is marked by our advocacy efforts and awareness creation to aim at eye health in populations, and also attention of policymakers and decision makers to give resources and priority to eye care. As it was said already, we actually work in two streams of activities. One is advocacy, which is mostly aiming at, as I said, decision makers, policy makers, should it be directors of our hospitals or even local authorities in healthcare, or ministries of health and their offices in districts. Those who decide about resources, about allocation and formulation of health programs, healthcare programs, so that they understand certain ideas and information and evidence how eye care and eye health is important in the frame of healthcare. And I will elaborate on that because there are certain issues which we need to really realize before we move on, so that we are aiming at successful advocacy plan and can guarantee that our efforts will be met with success. The other area is public awareness. We will not talk about that much, but we still need to realize that many people know very little about eye care, what eye care can provide these days, and they also may not understand the initial signs of eye diseases. Their knowledge may not go well beyond the understanding of refractive errors, the need for spectacles, and as we all know, there are several other diseases, unfortunately also major causes of blindness and vision impairment if they progress, which can be well addressed through prevention or early diagnosis and treatment. So public awareness is also a very important component so that we keep our population informed, and based on that information and their understanding, they demand the services. But let's go back to advocacy. As we said, the success is guaranteed if it's based on strong evidence. What do we need to know? We should know the major causes of vision impairment and eye diseases in our population. We should also know the efficient ways to diagnose, to screen, and to treat. We should know about preventive measures, and we should also know what kind of vision rehabilitation we would like or we can offer. With this knowledge, when we approach decision makers, they will be surprised. They will be surprised typically because they are usually not aware of the eye conditions and the range of them which can be treated, which can be prevented. They may not be aware about the economic impact of that activity, and they also will like to hear that through prevention and treatment, they make major savings on the account of late provision of services which are then addressing already advanced eye condition. The integration is also very important. We are not working in isolation. We need to understand that we compete in a way with other healthcare subspecialties. And for that, we need to look for synergies. We need to look for integration in broader health programs, healthcare programs, or even broader developmental agendas. It may be aging population. It may be a care for children and mothers. It can be various programs for those who are in working, let's say, age. Should it be diabetes and others? So the importance here is, of course, that we integrate, we look for synergies. The eventual success will also depend on the message we craft. We need to be clear what we want to accomplish. Do we want more resources? For what? How we will implement our ideas, our programs? What will be the actual measurable impact? All that needs to be really carefully crafted to be convincing and to give a reliable impression that the resources which we will eventually get or may get will be well spent and well invested. Where can we seek, let's say, inspiration, also evidence and examples, what has been accomplished and what should be done? We are very privileged this year that we have still a rather new publication published only by the end of last year by the World Health Organization. And this publication gives us a lot of inspiration and facts for what we would like to accomplish. Let me guide you very quickly through the chapters that you can orient yourself and you can actually direct your attention to where the information is captured. First of all, it's very good to realize that we need to look at vision and the sight from the perspective of public health, not only from the perspective of individual patients, but if we want to change the situation, improve, we need to have a public health perspective. The report gives a very good inspiration and guidance on how vision is important in our life and what it does if we are losing visual acuity or quality of vision, regarding quality of life, opportunities in our working career, in our life, educational opportunities, but also it gives advice on if this should happen and the current medicine cannot help with treatment, what can be done through efficient and effective vision rehabilitation. So what we are considering here is a continuum of care from health promotion, prevention, treatment to vision rehabilitation. The next area, which is very important to realize again, is that many decision makers think about vision impairment as an issue which relates to a fairly small group in population. It's not so, and we really need to explain that there are many eye conditions, and that includes uncorrected refractive errors, which are real risk for our eye health, for quality of our vision, and they need to be addressed. Previously, we would speak about millions being blind. We would speak about, let's say, 80% of vision, which can be prevented or the vision loss which can be prevented or treated. But these days we are realizing and recognizing with strong evidence that there are many, many more millions of people, as illustrated here and in the report, who are at risk of having their vision affected by eye conditions. Further, what will our policymakers and decision makers like to hear? They will like to know that we know the interventions. We know how to treat, how to diagnose the major causes of vision loss. Should it be diabetic retinopathy, cataract? Should it be glaucoma? Yes, we know how to diagnose, and for many of those conditions, we have either medical or surgical treatment, which is very effective. That's a very significant information which we need to convey. The actual challenges are also inbuilt in where our population is going. We are aging, people will live longer, the numbers are increasing in most of the countries. There will be many more people living on this planet. That, of course, concerns the size, the magnitude of the problem, the challenge, but also demands on the healthcare providers so that their numbers are also adjusted to the needs. And it's recognized that in many countries or districts or communities, there is still a major shortage of eye care providers. Finally, where are we in relation to the overall healthcare? We need to be integrated, incorporated in the universal health coverage, which is a driving force, although it may sound a little bit remote for us, it's a driving force for development plans of most of our ministries of health. It unites them under the umbrella of United Nations and WHO, and they will certainly resonate with them if we try to advocate for inclusion of essential eye care in those plans. Finally, what's the message here? The message here that we should keep our patients in the middle, in the center of our attention. Integrated, people-centered eye care, also integrated means integrated in the broader concept of healthcare. That means that our patients should be in the middle, care should be accessible, understood, demanded by them based on their understanding what they can receive and what they should receive, and the whole model of provision of healthcare should be adjusted to that concept. I talked in the beginning, and I will finish with that, about integrated healthcare, which of course should comprise eye care. That's a different level of integration. It means that we are likely to succeed in many areas if we don't think we can operate in isolation. It's not about vertical programs which are introduced specifically for eye care or even specific eye care eye conditions, I should say, but it's always looking for synergies. Care for elderly people, care for children, care for patients with diabetes mellitus. It needs to be an aspect of integration, sharing resources, and making the care accessible for those who should use it, for the recipients. We can build on the history of several initiatives as the time was evolving during the last 2 decades. We had Vision 2020, then we had Global Action Plan endorsed by all member states of WHO for developing sound eye care services. And now we have the Vision Report, which is also giving a very strong guidance as I try to summarize. You need to know that our ministers of health meet every year in Geneva in the World Health Assembly, and once we have eye care on the agenda, they are all informed, engaged, and knowledgeable. So we need to link to their memory of the World Health Assembly and use that opportunity to enter with sound and solid, reliable suggestions and programs. This is just a history of World Health Assembly resolutions on eye care, and I will finish with saying, please look at the World Report on Vision, look at the inspiration and evidence there so that we can jointly build integrated, people-centered eye care for all in need. Thank you so much.
So Ivo is speaking right now, and I'm the next speaker in 30 seconds. So this is ICO program. Yeah. Okay. Okay. Can I call you back after my? Okay. Okay.
Thank you so much, sir. That was really wonderful. It was very enlightening to know all about that. So now I will take the pleasure of inviting Dr. Gyan John Prakash. I'll just share my screen. Right. Give me a second. So,
ma'am, click on play.
Founding president of Global Eye Genetics Consortium. He's also the first director of Transformational Medical Technology Initiative, the COO and executive vice president at AMAR International USA, and the president and CEO of Metastatin Pharmaceuticals. At Pfizer, he served as the project scientist for the largest selling antifungal drugs in the world, fluconazole and voriconazole, that have been used by millions of HIV cancer patients and saved millions of lives around the world. He earned a master's and a PhD in microbiology from the University of Illinois at Urbana-Champaign. He also earned an MBA in pharmaceutical management, marketing at St. Joseph's University in Philadelphia, received postdoctoral training in biotechnology at the University of California, Los Angeles Medical School and the CDC at Atlanta. He earned an MBA in pharmaceutical management at St. Joseph's University in Philadelphia, and he's also the recipient of several awards and honors in the US and abroad, including the UNESCO Fellowship and the AAAS Award. He is currently the director at the Office of International Program Activities at the NEI-NEH USA. We welcome you, sir. So glad to have you here on this platform.
Okay. Thank you very much. I'm just sharing the screen. Okay. So can you see me?
Yes.
See okay, very good. So first of all, thank you very much, Dr. Aishwarya, for such a kind introduction. I'm really very happy to be here. Just to mention here that opinions expressed by me here are my own and are not of the US government necessarily, and the government doesn't bear any responsibility towards. So this is just a proviso here. However, one of the most important thing is that we are dedicating this session and presentation to our beloved Achi, the great grandmother who just passed away peacefully today. And I had the honor to see her just a few hours. Apparently, Dr. Natarajan just told me a few minutes ago that I was the last person to see her on the video call just before she passed away. So on the World Sight Day, she is our guiding light, and she wasn't only a person, she was an institution, and she will always remain with us, and our great prayers to her. May her soul rest in peace. So as you just saw from Dr. Ivo's presentation here, that on the World Report on Vision, that was so elegantly done. At least 2.2 billion people around the world have vision impairment, and at least 1 billion have that could have been eye issues that could have been prevented or is yet to be addressed. So you saw quite an elegant presentation on that and the details, and it's my honor to be speaking with Dr. Ivo Kotzer. He's a very good friend and a colleague who works with me very, very closely. And as we know, the 90% of the global burden of eye disease is shouldered by developing countries, where many treatable diseases, but most of the time go undiagnosed. And I'm delighted that people like Dr. Natarajan and Dr. Aishwarya are, and Dr. Radhika addressing right on the ground as we do many research collaborations. So research is essentially a very key component of any development. Doing science, doing research collaboration between developing and developed world is very much needed to accomplish many, many goals that was just elegantly highlighted by my colleague, Dr. Ivo Kotzer. So we want to do and advance the very high quality science in many areas of vision research to improve the standard of care, all those things highlighted just earlier in the presentation. And the organization I'm representing is called National Institutes of Health. National Eye Institute is part of NIH bigger umbrella. But if you look at the goals here, that the mission, the program that what we have, it's an agency of the U.S. government, Ministry of Health, which is called Department of Health and Human Services here, and NIH conducts and supports medical research to uncover new knowledge for improving the health of all Americans. And I highlighted here, it's in our, it's etched in the stone actually, that it's not only all Americans, but the human condition throughout the world. So we are very much part of, what goes on in biomedical research around the world. And as I said, National Eye Institute is one of the 27 institutes and centers here that are part of NIH. So the mission of the National Eye Institute is to conduct and support research, training, health information dissemination, and other programs that you just heard in the previous presentation that with respect to the eye diseases, visual disorder, mechanism of visual function, preservation of sight, and addressing the health issues that, and the requirements of the blind. That's our grand mission. So it addresses pretty much everything what was highlighted earlier. And so the mission includes advancing the knowledge of the visual systems, helping to prevent and treat eye diseases with the disorders of vision, and most importantly, and result is the improving the quality of life for people of all ages. And as my colleague, Dr. Ivo Kotzer, mentioned that, how this thing is lingering, likely to stay, and increasing in many areas for different age groups. So just to mention here that this year, our appropriation budget is over 824 million just for eye care research and eye research. So you can see that this really makes a huge difference, and it's all dedicated to eye programs. So what is our vision for international research and training, international programs, so that we are all connected here? So we truly believe that global science is interconnected, and we are actively involved in global research. We seek scientific opportunities. We identify shared priorities with different colleagues around the world, and we support of unique international opportunities. We support, since we are a taxpayer organization, supported by the taxpayers, the organization supports our domestic grantees to expand their international collaboration. We support international training fellowship, including a collaborative training program with the International Council of Ophthalmology. And then we form partnership with scientists, governments, companies, NGOs to leverage our expertise and our resources to address all those things that was mentioned in the earlier presentation. So the bottom line that I actually present and tell the world can apply for NIH science programs, science grants, and research. And as you can see that we are very heavily involved in training of global scientists at our institution. You can see that out of close to 90 fellows right now, India, which I know this, the Indian colleagues are taking actually the lead in organizing this program, and India is very heavily represented. China, South Korea, Canada, Israel, France, and many other countries. So we are truly an organization that supports training of the future scientists, the clinicians, as well as the research scientists. And not only that, the many scientists and clinicians have actually gone back and working in their countries. So that itself establishes a ongoing collaboration and investment in future programs that we are connected with. So the take-home message here is that for anyone from any country around the world can apply for NIH National Institute Biomedical Science grants for iResearch. Here's a link for that, but you can always Google that and search for it actually. The second thing I wanted to give here is that ICO and National Institute have collaborated to establish a new training fellowship for the early stage clinicians or clinical scientists from lower and middle income countries to support global research collaboration to improve eye health. So that's our investment, that's our commitment, and we are working very closely with the ICO. And the link is mentioned here, but you can always go to the ICO website to actually get the fellowship, in addition to the many other fellowships that they are supporting. So the final thought is that in the National Eye Institute supports the entire research curriculum continuum from basic science to translation to clinical trials that affect the clinical practice and outcome. Many opportunities exist to explore different mechanistic-based treatments through concerted and combined efforts and focused efforts to converting basic discovery into clinical application. And we're working on many collaborative eye health programs around the world with colleagues who we have trained and colleagues who work with us in various mechanisms and fashions. So that itself is a, is a very interesting and challenging program. And the Eye Institute, National Eye Institute, is at the forefront of research and training to improve global eye health by working closely with global leaders in eye research and service delivery, including we have close relationship with ICO leaders and members. And National Eye Institute is looking forward to the opportunity to work with the global organizations in developing programs to improve global eye health and all the things that were highlighted by my distinguished earlier speaker. And I just want to thank you very much by saying that good eye research anywhere is good eye research everywhere. We support the programs that were just highlighted. We support and look forward to working with many of you. So here's my contact information, and I'm delighted to be part of not only today's presentation, but having an ongoing relationship with many organizations around the world, including the ICO. So I want to thank ICO for organizing this, Dr. Natarajan, of course, the guiding light and taking a lead in organizing this, and Dr. Aishwarya for taking and filling in for him. We certainly bring this to and offer our deepest condolences to Dr. Natarajan and his family, and his Achi will live in our memory always as a guiding light. Thank you very much.
Thank you very much, sir. I now would like to the cause of preventable blindness as a refractive error. So as we see, as fellows and residents, we do attend a lot of camps, and we go to a lot of rural areas to help patients. And we see that, like I mentioned in the beginning of the talk, there is no access to refraction. Like there are no setups where, you know, good refraction, good pair of glasses. Most of them are using either old scratched glasses or don't have glasses at all. And we, who, you know, work as we said in cities, we consider refractive errors to be a very minor thing. We say that, oh, it's just a refractive error. So how is it possible to change that? And you know, there's a huge paradigm shift from people who don't have access to people who actually have it and who. What would you be your views on that, sir? Just if you could tell us.
So that's a really good good question, Dr. Aishwarya, and it's very interesting that India is playing a key role in actually not only addressing that but involved. You heard of a program called you know, it's called Project Prakash, and it just bears my last name, but it, you know, it existed before I joined National Eye Institute. So I did not name it as a Project Prakash, but this is a very established program which addresses part of that issue, that very issue that you, and it is a supported by National Eye Institute, the collaboration between MIT and Shrav and Dr. Pawan Sinha and Dr. Umang Mathur, they are the PIs. And they have been working on this for the last, I would say, at least 10 plus years. And this program actually goes to the rural camps and actually address it exactly what you have. So they go and work with the children. They work with, you know, issues of congenital cataract. And they not only bring these children to the hospitals, Shrav Hospital in Delhi, but have been able to actually convert their research findings into translational work. And this program has been covered very thoroughly around the world. If you're not familiar, just do a search on that. And I know Dr. Natarajan is very well connected with Dr. Umang Mathur. So I would highly recommend you to get the details of from Dr. Umang Mathur and Dr. Shalja Tibriwal and the whole Shrav team. But I'm glad you asked that question. I'm glad that, you know, but it's not also, that program is now expanding into other countries. And I'm sure that, you know, if you're interested, you could be connected to that too. But it is definitely, it is actually, you know, addressing many policy issues which you highlighted.
Perfect. Thank you so much, sir. That was an eye-opener for me.
Are there any?
So we have some live audience. Yeah, I'm just checking, sir. We had a live audience, and I have been provided with a link. Just checking if there are any questions from the live audience. Okay, there seem to be questions.
Let me just add one more thing here. Since do we have a minute? Do we have a minute here?
So, yeah, sure, sir.
Okay, so I just mentioned and saw on the slide that National Eye Institute is collaborating with ICO, and we just established this new fellowship, and we have presented some very capable, very highly qualified fellows to work with. And but as soon as this program started and we selected the fellows, that this whole effect of pandemic fell upon us. So
right.
we are delayed because of pandemic, but this is a long-term program, long-term commitment. And as soon as we are allowed to travel, we are allowed to bring fellows from different countries, we will have them be trained with ICO's help in our laboratory in clinical science, clinical research. And unfortunately, India is a very active participant in that. So just want to mention that this program will remain, will stay, and it has a full support of IC and NEI. Dr. Ivo?
Yes, so let me use this opportunity to thank very much, of course, Dr. Prakash, my colleague and friend, and also him to the National Eye Institute for this opportunity. You know, this is one of the possible results of good advocacy for improved knowledge sharing and skill transfer. It's also a practical example of what institutions or organizations can do together for younger colleagues, those who will then treat and influence the development of eye care for many decades to come. So thank you so much, and for bringing up this wonderful example, and also thank you for very informative and impressive presentation. Congratulations on the anniversary of the National Eye Institute and your very impressive budget, which will allow for a lot of quality work. Thank you.
Thank you very much. Thank you. Thank you for your kind words so much.
Thank you so much. Since we don't seem to have any so much to first, I would like the opportunity to thank Dr. Neeru Gupta, the president of the RCO. I then thank Dr. Ivo Kochur, Dr. John. I would like to thank the Aditya Jyot Eye Hospital IT team, Ms. Samir, Ms. Lakshmi Baji. Then I would like to thank the Echo Raman, Mr. Nikhil Masurkar, Mr. Vivek, and Mr. Rahul for setting this up on such short notice. That was a wonderful setup. And I will also take this opportunity to thank Dr. Natarajan sir for allowing me to fill in for him and for having that me that I will be able to carry on. I know I can never live up to him, but still I'm glad to be here, although it's very unfortunate that the circumstances are such. And thank you to all our listeners for patiently listening to us, and I hope you gain something from this webinar. Thank you so much, everyone. Thank you. We have Dr. Lakshmi. We have Ms. Lakshmi Balaji here.
Thank you, Dr. John, sir. Thank you, Dr. Ivo. Thank you, Dr. Aishwarya. And I thank Anthod team for for all the support. Thank you very much.
So much. Good luck with outside day. We'll connect again. Thank you.
Thank you.
Bye.
Bye. Bye. Bye. Bye.